Maybe you've heard it before, or maybe it happened to you. You're sitting down to breakfast, enjoying a tall glass of grapefruit juice the way you have for years, and your doctor calls to say your medication levels are off. Your dosage hasn't changed, routine hasn't changed, but something is clearly wrong, and the culprit is sitting right there on your breakfast table, looking completely innocent. This isn't a rare fluke. It happens to thousands of older adults every single year, many of whom have no idea that something as natural and wholesome sounding as citrus fruit could interfere so dramatically with their medications. Today we're going to unpack exactly why this happens, which fruits are most likely to cause problems, and most importantly, how you can still get the vitamin C your body needs without putting yourself at risk. I'm Dr. Naira Stein, and for many years now, my focus has been on helping older adults navigate the intersection of nutrition, aging, and medication safety. I've seen firsthand how a well-intentioned dietary choice can sometimes lead to unexpected and serious health complications, not because someone was careless, but simply because they didn't have the right information. And that's exactly what we're here to change. So if you're someone who takes daily medications and enjoys citrus regularly, or if you're caring for a parent or loved one who does, I want you to stay with me through this conversation. What you're about to learn could genuinely protect your health and the health of someone you love. There's no need to feel alarmed, and there's certainly no need to feel embarrassed if this is new information. Most people were never told about this in the first place, and that's not their fault. Our goal today is simply awareness, because when you understand what's happening in your body, you're in a far better position to make choices that support your health rather than quietly undermine it. Let's take this one step at a time. To understand why grapefruit and certain other citrus fruits can interfere with medications, we need to talk briefly about how your body processes the drugs you take. When you swallow a medication, it doesn't go straight into your bloodstream the way you might imagine. Instead, it travels through your digestive system. And in the wall of your small intestine, there are special proteins called enzymes, whose entire job is to break substances down before they enter circulation. One of the most important of these enzymes is called CYP3A4. It acts like a kind of gatekeeper, metabolizing a wide range of medications and controlling how much of a given drug actually reaches your bloodstream. Under normal circumstances, this is a beautifully calibrated system. Your doctor prescribes a specific dose, knowing that a certain percentage of it will be broken down before it's absorbed, and the remainder is what produces the intended therapeutic effect. Now, here's where grapefruit enters the picture. Grapefruit contains natural chemical compounds called furanocoumarins. These compounds don't just interact with CYP3A4, they essentially switch it off. And unlike most food and drug interactions, this isn't a short-lived effect. A single glass of grapefruit juice can suppress that enzyme for up to 24 hours, sometimes longer. That means if you drink grapefruit juice in the morning and take your medication in the evening, the interaction is still very much active. When the enzyme is suppressed, your medication isn't broken down in the usual way. Much more of it floods into your bloodstream than intended. Depending on the medication, this can mean you're effectively receiving 2, 3, or even more times the dose your doctor prescribed, without anyone changing a single thing about your prescription. For certain drugs, that kind of accidental overdose is not just uncomfortable. It can be genuinely dangerous. The list of medications affected by grapefruit is longer than most people realize, and it spans categories that many older adults depend on daily. Let's walk through the most important ones. Cholesterol-lowering statins. Statins such as atorvastatin, simvastatin, and lovastatin are among the most widely prescribed medications in the world, and they're heavily affected by this interaction. When grapefruit juice raises blood levels of these drugs, it significantly increases the risk of muscle damage, a condition called myopathy. In severe cases, this can progress to rhabdomyolysis, where muscle fibers break down and release proteins into the blood that can overwhelm the kidneys. Seniors are already at higher risk for muscle weakness. This interaction makes that risk considerably worse. Blood pressure medications. Several calcium channel blockers used to manage high blood pressure, including amlodipine, felodipine, and nifedipine, are metabolized by the same enzyme pathway. When grapefruit suppresses this process, blood pressure can drop too sharply. For an older adult who may already be prone to dizziness or lightheadedness when standing, a sudden drop in blood pressure dramatically raises the risk of a fall, and falls in seniors can have life-altering consequences. Heart rhythm medications. Drugs used to regulate abnormal heart rhythms, such as amiodarone, are also affected. An unintended spike in blood levels of these medications can disrupt the very heart rhythms they're meant to stabilize, which is obviously a serious concern for anyone with a cardiac condition. Immunosuppressants. For seniors who have had organ transplants or who take immunosuppressive medications for autoimmune conditions, drugs like cyclosporin and tacrolimus are critically dosed. Even small fluctuations in blood levels can mean the difference between effective therapy and dangerous toxicity or rejection. Grapefruit is consistently flagged as a serious concern for patients in this category. Anxiety and sleep medications. Benzodiazepines, such as triazolam and certain sleep aids, are also metabolized through this pathway. Elevated blood levels can cause excessive sedation, confusion, memory impairment, and an increased risk of falls, all of which are conditions we particularly want to avoid in older adults. The important thing to understand is that this interaction isn't about the amount of grapefruit you consume. Even a modest amount, a few sections of fruit, a small glass of juice, is enough to trigger the effect. And because the enzyme suppression lasts so long, timing your grapefruit away from your medication often isn't a reliable solution. Many guidelines advise avoiding grapefruit entirely if you're on an affected medication. At this point, a very reasonable question comes up. If grapefruit is so problematic, what about other citrus fruits? Are oranges safe? What about lemons, limes, or tangerines? The honest answer is that it depends on the fruit and the medication in question, and the picture is more nuanced than many people realize. Regular navel oranges and most common sweet orange varieties do not contain significant amounts of furanocoumarins, which means they don't interfere with CYP3A4 in the same way grapefruit does. For most medications, a regular orange or a glass of standard orange juice is unlikely to cause the dramatic drug interactions we associate with grapefruit. That's reassuring news for people who love citrus. However, there's an important exception worth knowing about. Seville oranges, also called bitter oranges, are a different story. These are the tart, pungent oranges used in some marmalades, certain fruit juices labeled as bitter orange, and in some herbal supplements marketed for energy or weight management. Seville oranges do contain furanocoumarins, and they can produce a grapefruit-like interaction with medications. So if you're purchasing artisan marmalades or any supplement containing citrus or antium, it's worth raising that with your pharmacist. Tangelos, pomelos, and certain hybrid citrus fruits also contain varying levels of these compounds, which is why some pharmacists will advise patients on high-risk medications to approach any unusual citrus variety with caution. Lemons and limes, on the other hand, contain very low levels of furanocoumarins and are generally considered safe in typical culinary amounts. Squeezing lemon over your food or adding lime to water is unlikely to create a clinically significant problem for most people. There is one separate category of citrus drug interaction that deserves mention, and it's different in its mechanism. Citrus fruits, including regular orange juice, are high in vitamin C, which is mildly acidic. For some medications, acidic foods can alter the way the drug dissolves and is absorbed in the stomach. This is a much less dramatic effect than the enzyme-blocking interaction, but it's still something your pharmacist can advise you on based on your specific medications. Now, I want to be very clear about something. The fact that grapefruit poses a risk for people on certain medications does not mean you should be avoiding vitamin C. Quite the opposite. Vitamin C remains one of the most important nutrients for aging bodies, and many older adults are not getting nearly enough of it. As we age, our immune function naturally declines. The skin becomes thinner and heals more slowly. The connective tissues that support our joints, blood vessels, and organs depend heavily on collagen, and vitamin C is absolutely essential for collagen synthesis. Without adequate vitamin C, the body loses its ability to maintain and repair these structures effectively. Vitamin C is also a powerful antioxidant. It helps neutralize free radicals that damage cells and contribute to conditions like cardiovascular disease, cognitive decline, and even certain eye conditions such as cataracts and macular degeneration. Studies have consistently shown that older adults with higher vitamin C levels tend to have better immune responses, healthier skin, and lower rates of chronic disease. There's also the matter of iron absorption. Many seniors, particularly women, struggle with adequate iron levels, and vitamin C dramatically improves the body's ability to absorb non-heme iron, the kind found in plant-based foods. For anyone managing mild anemia or iron deficiency, vitamin C isn't optional. It's a functional necessity. The current recommended daily intake for adults over 65 is 75 milligrams for women and 90 milligrams for men, though some researchers argue that optimal intake for aging adults may be higher than these baseline figures suggest. The good news is that reaching these levels through food is very achievable, even without relying on grapefruit or high-risk citrus. This is the part I genuinely love sharing, because it opens up a world of options that many people don't realize they have. You don't need grapefruit to meet your vitamin C needs. There are foods that are just as rich or richer in this vital nutrient, and they carry none of the medication interaction risks. Bell peppers. This might surprise you, but a single medium red bell pepper contains well over twice the vitamin C found in a medium orange. Yellow and orange peppers are similarly rich. They're mild in flavor, easy to slice and eat raw with a dip, and equally delicious roasted or added to soups and stews. For someone looking to boost their vitamin C intake without any medication concerns, bell peppers are one of the very best choices. Strawberries. Fresh or frozen strawberries are an excellent and widely available source of vitamin C. A single cup of strawberries provides close to the full daily recommended amount for most adults. They're naturally sweet, easy to prepare, and pair beautifully with yogurt or oatmeal for a nourishing morning meal. Frozen strawberries retain most of their nutritional value and are available year-round at a very reasonable cost. Kiwi fruit. Kiwis are remarkable little fruits. 2 medium kiwis provide more than the entire daily recommended amount of vitamin C for most adults, along with fiber, potassium, and vitamin K. They're soft enough for people with dental sensitivities, and their natural tartness makes them feel refreshing. Emerging research also suggests that kiwi consumption is associated with better sleep quality in older adults, which is an added benefit worth noting. Broccoli and Brussels sprouts. Cruciferous vegetables like broccoli and Brussels sprouts are excellent vitamin C sources that also deliver fiber, folate, and a range of compounds with demonstrated anti-inflammatory properties. Half a cup of cooked broccoli provides a meaningful portion of the daily vitamin C requirement. Steaming or lightly sautéing these vegetables preserves more of their nutrient content compared to boiling. Regular sweet oranges and mandarins. As we discussed earlier, standard sweet oranges and clementines are generally well tolerated and do not carry the same interaction risks as grapefruit. If you enjoy citrus and your pharmacist has confirmed that your particular medications are not significantly affected by regular orange juice, there's no reason to give it up. A medium orange provides roughly 70 milligrams of vitamin C, which is close to the full daily target for many adults. Papaya. Papaya is a soft, sweet, easy-to-digest fruit that's particularly well-suited for older adults. A single cup of papaya provides well over the daily recommended intake of vitamin C, and it also contains digestive enzymes that support gut health. It's gentle on the stomach and available in many grocery stores year-round, either fresh or in the freezer section. Tomatoes and tomato-based foods. Tomatoes are a modest but consistent source of vitamin C, and because they're used so widely in everyday cooking, their contribution adds up. Tomato soup, pasta sauce, and fresh sliced tomatoes all count toward your daily intake. Cooking actually increases the bioavailability of lycopene, another beneficial compound in tomatoes, while only modestly reducing vitamin C levels. One of the most important messages I want to leave you with today is this: you don't have to figure this out alone, and you shouldn't have to. Your pharmacist is one of the most underutilized resources available to older adults, and medication-food interactions are exactly the kind of question they're trained to answer. The next time you pick up a prescription, or the next time you have an appointment with your doctor, consider asking directly, does any medication I'm currently taking interact with grapefruit or citrus? Are there any foods I should be cautious about? It's a simple question, and the answer could be genuinely important for your safety. If you've been consuming grapefruit regularly while on medication and you're concerned, the best course of action is not to panic or abruptly change anything without guidance. Instead, reach out to your healthcare provider and describe your routine. They can review your specific medications and help you determine whether any adjustments are needed. It's also worth knowing that not every medication in a given drug category is affected equally. For instance, among statins, pravastatin and rosuvastatin are generally considered much lower risk with grapefruit than simvastatin or lovastatin. Your doctor may be able to adjust which medication you're prescribed if grapefruit is important to you, and an alternative exists that's equally effective for your condition. Finally, if you're considering taking a vitamin C supplement rather than relying on food sources, that's generally a safe and effective option. Standard vitamin C supplements do not interact with medications in the same way that grapefruit does. However, as with any supplement, it's wise to mention it to your doctor, particularly at higher doses, since vitamin C in very large amounts can occasionally affect how certain medications behave. As we get older, our relationship with food and medicine becomes more nuanced. The body changes, the number of medications often grows, and what worked perfectly well for decades can sometimes require a fresh look. That's not a sign of weakness or decline. It's simply the reality of an aging body that's still very much worth caring for. What I hope you take from today is not fear of citrus, but rather a calm, informed awareness. Knowing which foods interact with your medications, and why, puts you in control of your own health in a very meaningful way. It allows you to make choices that are both nourishing and safe, so that the habits you've built to support your body don't inadvertently work against it. Your health awareness is not something that fades with age. If anything, it grows richer and more refined as the years pass, and so does your ability to care for yourself with wisdom. I'm Dr. Naira Stein, and it's always my privilege to be part of that journey with you. Thank you for spending this time with me today. If this conversation raised questions about your own medications or diet, I encourage you to bring them to your doctor or pharmacist. And if you found this helpful, please share it with someone you care about, because this is the kind of information that can make a real difference in someone's daily life. Take good care of yourself, and I'll see you in the next one.